Tshabalala, Chairperson of the Treatment Action Campaign, joins us now. Sibongile, thank you so much for joining us. Really appreciate your time. No, it appears we are not yet connected. Are we connected? Sibongile, are you there? Perhaps if you unmute, because that happens to me a lot. Hello, Sibongile, are you there? No.
Hello.
There you go.
I'm here.
There you go. Excellent. Are you well this evening?
I'm well. I'm well, and how are you?
I'm well.
Just tired.
But I understand the pause before you said that you were well, because I suppose recent developments have had a major toll, not on yourself as TAC, but on all of the projects that were funded by USAID under the FEFA program. Tell us the South African reality as far as that is concerned. And I'm going to perhaps introduce into this conversation what I was going to talk about before we connected. But tell us about the South African reality as far as this is concerned. Hello, Sibongile. All right, it looks like we are having difficulty connecting with her. Okay, but let me, while we try to connect, ask you this question. I know that there are real efforts at trying to re-establish and stabilize diplomatic relations with the United States, particularly from our government and many others who have understood the value of these connections with the American government. And so there are indeed correct attempts to say, please understand that when you speak about this issue, it is not a matter of the United States under the Trump administration targeting South Africa. This is a manifestation of certain policy decisions that have been made by the United States to try and, I don't know, save the American tax dollar. Is she in? Is she big? Is she back? Okay. Sibongile, are you there? All right. This is just not working. All right. Anyway, so I'm not sure if you guys are going to connect with her again. Let me know if we do. All right. But here's what I'm wanting to invite calls about. So I'm aware that there is a real need for us to try and establish and stabilize the diplomatic connections that we've had with the United States, which are under strain at the moment for several reasons. And for that reason, there are those that are saying, listen, stop making it sound like it is an attack on South Africa exclusively. This is a decision by the United States to go into whatever tax saving money. I mean, American taxpayer saving methods, and it's got nothing to do with an attack on South Africa. I get that. It makes a lot of sense, because in that way we can then say, we understand, Mr. America, Mr. Trump, that you don't hate us. You're just doing what you need to do to save the American dollar for the American people. See? So I get that. I understand that. Yeah. And then there are those who are angry at Donald Trump and the U.S. administration, and are saying that he is this, and this for taking away this money that we so desperately need, that is helping so many people and making sure that people's lives and the quality of lives are better. And for them to pull it back in the way that they've done is nothing more than barbaric and blah, blah. You've heard the rhetoric. There are those who feel that way. Then there are those who feel, look, it's not our money. We were lucky to have the support. Those of us here in South Africa and other parts of the world, we were lucky, and it reflected a global sense of responsibility by a superpower, which is needed. We need more of those in the world. And so it's a regrettable situation that America has taken this position, because a lot of people are going to get hurt. But in all of those conversations, each of the countries that have been affected by this decision even though it might not necessarily be a decision to come after South Africa or Vietnam or Mexico specifically, that it is a wide-ranging set of consequences. Each country has got a unique experience of what this means to them.
Yeah.
Now, when we speak of our unique experience of that decision by the Trump administration, it does not mean that we are unaware of the fact that these decisions were made with America in mind by Trump, not South Africa in mind. We understand that. But these decisions do affect South Africa. And the effect is not a very pleasing one. It's not a nice one. So when we have the conversation that describes how we are affected by this decision, it is not because we are under the impression that this decision was made purely to target South Africa. We're aware of that. But surely there is room to understand that there is a very unique experience of these developments by South Africa. And that is what we are talking about. What is the experience of South Africa as a result of the decision made by the Trump administration? Whatever your opinion is, as it relates to our strained diplomatic relationships with America, that's fine. That's a conversation we can have. But when we speak about how this decision has affected programs that are here in South Africa, it is not because we are thinking that this is an effort by America to destroy South Africa and South Africa alone. We are very much aware of the fact that this decision touches many other countries. Yes. I think I'm told that there are something like 5,000 other programs in other countries that have been affected by this decision. But it also affects us here in South Africa in a very unique way. It is that discussion that we are going to be having with Sibongile Tshabalala. It is not because we are oblivious of the fact that this decision touches other countries and other regions and other spaces too. But we are in South Africa and we are South Africans and we are talking about the South African experience of this phenomenon.
Yes.
Sibongile Tshabalala, you're back. Good evening to you. I suppose the question that I'm going to start with is understanding that the decision by the Trump administration to stop this funding has touched many other countries and many other regions. I'm looking to hear from you. How has it touched the South African chapter of all of these activities?
Good evening again, and I'm sorry for my connection. It touched a very bit. Yes, it might look as if we haven't seen a much impact, but people on the ground already feeling the impact of this grant, of this funding cut. Let me start with the issue of human resource. We know under this grant, over 15,000 people were employed, and as we are talking today, they are laid off to work. They are not sure about their future. And the very same people that we are talking about were assisting in supporting our healthcare system in terms of human resource in facilities. And mostly what they were doing is to make sure that they call people who are missing into care, who have missed their dates, and make sure that the testing is happening, and also making sure that when we go to facilities, we are able to take, we are taking our blood, and we are able to continue with our HIV programs in a correct way. So there is a lot that has been happening through this funding. Through this funding, there were research that were going on, or studies that were going on in terms of fighting HIV and coming up with new developments. So without this funding and the way it has been cut, it has destabilized our programs in terms of HIV services. It has destabilized our progress in terms of putting more people into treatment, in terms of keeping people into treatment, and all those things that we've been complaining about, to say we are spending more time in the facility than we are supposed to. And we were looking forward to say now we are planning for the next 5 years. As much as we others will say 17% is a legal money, is a legal percentage, we cannot complain, but it had a huge impact. As you rightfully said earlier on, to say this is not a South African problem, it's other countries are also affected by this problem. I always make this analysis of our neighboring countries to say when they are struggling, where they will come, where they will go for treatment. Obviously, they will come to South Africa. Already, our healthcare system is strained. Already, our healthcare system cannot be able to cater for us. And without this funding, then it means then our lives as people living with HIV are more in danger than before.
17% is what the assistance from the United States represents to all of these efforts at dealing with HIV-related programs. Where else is the other money coming from?
So we know that also we are funded by Global Fund. Global Fund also supports South Africa a lot, and then the other percentage is coming from our government fiscal.
Do we know what the difference in percentage is between what comes from the Global Fund and government is?
I don't have that information yet.
We no doubt are going to feel the pain of the 17% that was being donated by FEPFA or the USAID, right? What were we doing, Sibongile? Because, my sense is that we knew that this was not going to be permanent, right? Were we doing anything to make sure that in the event of what is now happening, we would be in a better position to absorb the pain that comes with the removal of these funds?
We anticipated that this funding will end, especially from 2 years ago when we had meetings with and they started talking about sustainability. So always when we had the meeting, we always asked us to say, are we having ways of sustaining our programs and all those things? But the way they have been, the way it just came to our faces like a bomb, we never anticipated that it will end like this. We thought we'll have time to prepare ourselves and be able to cover that 17%. But also this shows us of always trying to depend on the foreign funding and trust the foreign funding in terms of our health issues. Yes, we were supposed to be ready for this in any time. We were not ready because we never thought this would happen just like this. For the fact that there was bilateral.
How did we think it would happen? Did we think we'd get like a warning, maybe for a couple of months or a couple of years? What was the thinking in terms of the kind of warning we would have received that would have been optimal for us?
We thought that because there are bilaterals that are happening, there are contracts that are involved. So, as I'm saying that the discussion has been started already. So we were thinking that progressively we are going to work together, and while we're sustaining our programs in our countries, and then when or they decide otherwise, will be ready as a country to do so. So in our conversation with our own government was to say, you need to now to start to plan to say, how do we sustain our own government? But unfortunately, because we never thought that it will just happen. It just did.
Sibongile, our line is not the best, and so maybe our conversation won't last as long as I had hoped it would. Tell me about the Global Fund. Who is that? What is the Global Fund? Who are the constituent members of the Global Fund? I'm asking because, maybe there might be somebody within the Global Fund who might spring a similar type of decision on us. Who is the Global Fund?
Okay, the Global Fund it's a multi-country funding, so it's a pot where all countries, including our country, South Africa, where they are donating in towards the fight against HIV, TB, and malaria. So every there is a grant cycle where all countries, most countries, pledge to say how much they that. A pot, which they call it Global Fund, and then Global Fund disseminates funds as the country's request. So as South Africa, we are pledging to Global Fund and we are donating to Global Fund. After that, we will do a request based on our needs. So most countries are also doing that. So that is a pot just to assist most of the countries that are mostly affected by HIV, TB, and malaria in terms of fighting these diseases. So almost, I think there are a lot of South Africa.
Oh. All right, Sibongile, our line is really, really bad. We're not getting any value out of our conversation. I'm gonna excuse Sibongile because we can't really get a hold of her. We've been trying to, get the right sort of connectivity, and maybe we suspend this conversation for another time because we honestly can't hear what she's saying. What I did want to ask was, of the money that we were receiving from the United States for these programs, how much of it went directly into programs that were about the procurement of medicines, the training of people? So in other words, directly involved, because we've been hearing also from the United States that some of the money went into the sponsoring of NGOs, yes, for example, that had particular mandates that perhaps didn't agree with U.S. policy as it now emerges, but which may have had detrimental effects on the South African government too. Yeah. So for me, that's an important issue, and maybe it's part of the conversation we need to have about the fact that we have now been told by the United States of America that they are leaving the Just Energy Transition Program. And again, there are those of you who have been very quick to remind us of the fact that the decision by the United States to leave the Just Energy Transition Program is not just an attacking of South Africa. Sure, it might be the case. That might be the case. And for me, the conversation is not about whether or not we're being attacked or not. Because I understand that maybe those people who are quickly reminding us of that have another job to do, and that is to try and repair diplomatically the relationship that we find between South Africa and the United States strained at this point. Yeah. But there is going to be a particular experience of this decision by South Africa and South Africans. Mm-hmm. I hold the view that, look, America has every right to do with its money what it wants to do. Yeah. It's regrettable, of course, when we are badly affected by those decisions. And we ought to do everything we can to try and mend relationships so that we can bring about normalcy. But we should also understand that we can't have a relationship with the United States that is that is entitled. It's not our money.
Sure.
So what is it that we are doing in the interim to make sure that we wean ourselves from our dependency? Is the line better now, Uzintading?
It's another number.
Is it another number?
Yeah.
We're going to try? All right. It looks like we are going to speak
Yeah.
to Sibongile another time. Sibongile, are you there?
Yes, I'm here.
Much better line. Much better line.
Oh, much better. Oh, I wasn't trusting this one.
Yeah, no, that's fine. Let's stay with the one that you don't trust. It sounds good. I wanted to understand that of the money that we were receiving from USAID
Yes.
for, let's say, that 17%, what exactly was that money doing? Because we've also been hearing that some of that money was sponsoring certain NGOs that might not necessarily have been about HIV programs. Could you give us that information?
I don't know any of those NGOs that are not HIV programs. All I know is that most of the NGOs that money was supporting were doing the work of HIV. And I have number of them that were doing also research towards HIV. So the ones that were not doing HIV services, honestly, I can't comment on that because I don't have that information. So I wouldn't like to comment on something that I don't know.
Did you receive money, cash from USAID?
Not on our side, not directly cash. So for us, a treatment action campaign, we received money direct from PEPFAR to UNAID, and then it will come to us. So there was no money that is coming direct from PEPFAR or USAID to us. But we had an agreement with PEPFAR and UNAID through UNAID, so that's how we were getting funding.
Because somebody's telling me that the agency of the USAID is an agency of the US government, which it used to distribute its own contributions based on the request received per qualifying program, that the US didn't give hard cash to any country.
No, they don't give hard cash, but they always contribute towards the programs.
So you didn't receive hard cash, but you did receive, I suppose, the services that you required, which would have been paid for by the money from this agency.
So they do give us money to
Yes.
do services.
Okay, so you did get cash.
I don't understand the question when you say we don't get
Let me
cash.
explain. Let me explain. I think you're correct
Yes.
too. So there are some people who believe that no money came directly to organizations that are involved in HIV programs, that it only came as services, but no money was ever put into a bank account. For example, of TAC. Did money ever come to your bank accounts?
There is money that is coming to our bank account.
Okay.
That money is for services. So we always have a contract to say how much are we getting to do whatever that we're supposed to do. Like, for instance, TAC was doing community-led monitoring. So every year, PEPFAR will bring auditors to audit and look at the reports. We always report to UNAID to come and to know that, so that they will know how much we have used, how did we use their money. So there is no money that comes just to support organization to do whatever. Every money that is coming, it's coming because of the certain purpose.
Yeah. And I imagine that there were different categories of needs that you had as various programs. So, for example, you guys at TAC did these monitoring programs. What other programs were there that PEPFAR would have been financing?
So there are other, like as I've said earlier, there are programs of prevention programs for young people. There are programs for key and vulnerable populations that we're supporting, where they go straight to where the key and vulnerable populations are. Like, for instance, they will buy mobile clinics and go to where the hotspots of sex workers and provide prevention methods like your condom, your PrEP, and education, and also some for those who are HIV positive, they will get their ARVs. There was research that was happening through VETS RHI, through Caprisa,
Yes.
that was funded by PEPFAR, and there is a lot that this USAID funding was doing.
Yeah.
And there were programs, outreach programs that were happening, trainings, and I can count number of things that it has been doing. It was also focusing on the GPV program. There is a lot that it's been happening. It's been doing.
And was some of this money used to pay for salaries, for example?
Definitely. Remember, when you have a program, you need to have people who will work on that program. So when we do the funding request, you always put money for salaries. Hence, we are saying now, and even the government knows, 15,000 people have lost their jobs because of this funding cut.
And I imagine that there were certain hotspots for some of these programs. In other words, where there was a greater need in one area, perhaps less so in another. Where were the hotspots for PEPFAR programs in South Africa?
So the hotspots mostly were those ones that are servicing key and vulnerable populations. As I indicated, that the sex worker program, which it was supporting them in terms of giving them medication and all those things, but also the drug users. Remember, there's stigma and discrimination against them in facilities. So in most cases, they don't like to go to facilities. So through these programs, the organization will go to where they are, so that they give them preventative methods, the medication, and those who need better care, they will be taken to hospitals and clinics like that. And also the programs for LGBTI community, especially the trans people who needed to get hormonal pills. In the public facility, you don't get them. But through those mobile clinics and centers, drop-in centers, they were able to get that, including condoms, femidoms, and dental dams. So there is a number of hotspots that they were doing. And also they were supporting gender-based violence programs where women who are raped, they were able to access healthcare through Zela centers, which are funded both by a Global Fund and PEPFAR.
And in all of this time that we were getting the support, particularly by the Biden administration, was there any indication that should there be a change in administration, there may be a pulling back of the support of PEPFAR for all of these programs? Was there any indication, however mild it might have been in the past?
There was not. Remember, this funding is not something that started with President Joe Biden, but it's something that was started by President Bush around 2003.
Yes.
So it's been like a normal thing, knowing that this is the commitment that Americans have been doing to support the world in fight against HIV and AIDS. So no one ever thought that this will happen, or when there's a change of administration, this stance will be pulled. So we never thought this will happen. We are all shocked. What
was the reason given to you as programs in this space by PEPFAR and USAID as to why they are pulling back the funding? What was the stated reason?
Unfortunately, there was no time for us to be given those reasons because the executive orders just happened and all the systems were disconnected and no one was told what is happening. All we received a stop order letters to say our funding is freezed for 90 days under reviews without any explanation and without any preparation. So no one was able to also answer to say what is really happening, because even the USAID office in the country was closed down, and they were unable to speak about this issue. So no one could have given us answers.
So you're saying to me that you weren't even were able to prepare yourself for a counter argument, because no argument was given to you as to why this money was being stopped?
No one.
And obviously there's politics around all of this. I mean, the rise of the Trump administration was not necessarily secretive about some of its policies as they pertain to the LGBTIQ community, the support for trans people and so forth. We know that they are quite conservative as far as that is concerned. As we were watching the unfolding political reality in the United States, did it ever occur to us here in South Africa that there would be a possibility of this kind of thing happening, given the politics of the Trump administration?
Honestly, no, it never came to us. What we were thinking about is a gag rule. That's one thing that we were concerned about. But remember, this is not the first time Trump is being on administration.
Yes.
And this has never happened. The only thing that we knew about it was a gag rule where he didn't want to hear anything about abortion and supporting abortion and all those things. So that's what we were concerned about and worried about. But all other stunts that he has pulled now, we never anticipated them. We knew what is his beliefs, but in a country like US where we believe there's democracy, we thought that he cannot just pull off the funding. We never thought he would just do that without also engaging with the Congress. So with this, no one has ever thought about this and unfortunately, some of us, it was the first time hearing that the president can just take executive orders just like that.
15,000 jobs have been affected by this. Talk to me about the number of people with HIV who are on one or other program with regards to interventions against HIV and AIDS. How many people are we talking about in the South African context?
So in South Africa, we have about 8.1 people living with HIV. And
8.1 million, huh?
Yes, 8.1 million. And out of that 8.1 million, we are talking about 5.5 million people who are on treatment, of which we are still having some around 2 million people who are not on treatment in South Africa. And out of that 5.5 million, if you remember last week, the minister has launched a 1.1 campaign. So out of that 5.5 million, we lost 1.1 million into care, which those people, they need to be found and be brought back to care. So it means those are the people who have started education and then they disengaged to care. So the campaign is looking at how do we bring those people back into care so that we can be able to also to close the gap of the other 2 million. So the challenges that we still have in South Africa, they don't allow any vacuum, they don't allow any funding gap or anything. So that is why you've had us as people living with HIV and organizations that are working with people living with HIV. We were not quiet ever since this funding freeze has happened. We raised our voices and we urged our government to say something, because we were concerned to say if we are taking long to take decisions and implement some plans which will close these gaps, then we might lose a lot of people into care, because if people are unable to be stable on care now, then without the funding, with all this intervention this funding was doing, then it means we are about to lose more people into care, and we will start to experience more HIV and TB deaths again.
So it sounds to me, Sibongile, as though whatever gains we've made over the last 2 decades, those gains can be reversed in terms of,
Yes.
because I remember we were at some point the number one most infectious country in the world as far as HIV was concerned. And it appears that we have made some great strides as far as that is concerned. Was that due to USAID?
I cannot just say it was due to USAID alone. Remember, also our government played a role in that. But you know, those united efforts from other funders and our countries and the work that we are doing as civil society, all of us together, we can claim the victory to say we made those gains. It cannot be true that it's only USAID who have made those gains, but it's through the efforts of all of us, and we'll manage to be where we are as a country and as a world in terms of fighting HIV.
Based on what you've just said to me earlier about the allocation of the various funds coming from different funders, whether it's the government, whether it is global, what did you call it? Global what?
Global Fund.
Global Fund, or whether it's USAID, it sounds to me, and forgive me if I'm wrong and put me right, that the money that came from USAID focused mainly on work that is being done for people with, people who are LGBTI, people involved in the sex work industry. Was that a deliberate decision?
No, I think it didn't get me right.
Yeah.
So not only on those people, but, you know, through this funding, we were able to cover mostly of those people. The USAID funding, it was supporting mostly the programs of HIV and TB in South Africa. So, like, for instance, you will go to a clinic and you'll find one organization working there. Let me say, for instance, you'll find your organization like NACOSA, ANOVA, Right to Care in the facility, supporting that facility, having data capturers, adherence facilitators, those who are doing counseling and testing. Some of them, they are taking bloods and all those things. Those NGOs were working with HIV programs in facility for everyone. But there are those special needs that also supported, not that our government and Global Fund are not, but through their intervention also, it has assisted to cover those gaps.
I say this because part of the rhetoric that we were hearing from some of the Trump administrators was that they were not willing to continue supporting things that were outside of their moral standards and codes. Did that ever come through in some of the commentary that explained why the money was being pulled back?
Yes, that's what they've been saying. But the honest truth of everything is that the funding is not only supporting those programs only. Hence, you also in the U.S. organizations that were mostly supported by USAID in the U.S. who are doing key population programs were also affected by this funding cut. So that is not true that it only focuses on the key populations, but it focuses on mostly people living with HIV, but then it makes it easier for those who are key and vulnerable populations. And I need to say this to say, even Global Fund does have those programs. Just that, as I'm saying, that if we are working together and combine resources, then we are able to get better results than when we are only expecting one person, like, for instance, our government in this case, where we know for a fact, me and you, as we are talking, that our government and our healthcare system, our government is struggling to maintain our healthcare system. Every now and again, there are issues of infrastructure, there are issues of shortages of medication, there are issues of shortages of human resource, there are issues of paying actuals and all those things. So there are a lot of challenges, but this funding assisted us specifically on HIV programs, HIV and TB programs, to be able to be where we are today. It contributed, let me put it in the right English, to say it contributed like Global Fund, like our government and other stakeholders who continues to support us.
What is the effect going to be for this moment? I mean, for this decision? What are the results going to be? What can we expect to happen now that this money has been withdrawn?
According to the stats that, or the research that we are getting now, we can expect more deaths in the coming few months or years. More than 600,000 people living with HIV will die
as a result of.
And as a result of this funding cuts.
In other words, will that be because we don't have enough ARVs? What would be the functional reason for that?
The reason for that it will be because there are no programs that are talking to people living with HIV. We can have ARVs, but without support and programs, then it will be difficult for us to sustain those people. As I indicated earlier, to say already with everything, all the interventions that we have, already we are losing 1.1 million into care. So it shows that there is a gap that might be that needs to be closed. And with now funding that is less, the cutting of funding, then it means then we'll have more problems. So people will die. Programs that TB researchers and programs are collapsing, and we'll see more people also again dying of TB because we want new developments. This funding was also supporting research and development into new medications and all those things. So the new interventions, the infection rate, it will increase. So there is a lot that is going to happen, and there's a lot that is at stake.
What are we doing as the organizations, and I imagine government included, World Fund included, what are we doing to mitigate against what may be going to happen as you describe it, but to make sure that sustainably we don't find ourselves in a situation where we are flat-footed should something like this ever happen again, that a significant donor pulls back the donations?
You know, as the country, this is a learning curve, and I was a bit relieved when I heard the minister saying the government has a responsibility to make sure that everyone in South Africa is accessing the quality healthcare services, and it's time now that we as activists, as government, as private sector, we need to sit around the table and find these resources, because it's not like we don't have these monies in the country, but these budgets are allocated where are not mostly needed. But then also the role of the private sector in South Africa is really important. We've been saying in Treatment Action Campaign that the government should stop paying medical aid and use the public healthcare sector, as this healthcare sector is made for everyone in South Africa. And I was glad to hear the minister saying that they need to take a resolution in Parliament to say all more parliamentarians, they must stop using a medical aid or private sector. They need to start using the public healthcare sector. And by doing that, they will feel our pain and they will improve the services on the ground. So this is the first step that we need to do, is to combine all the resources. All the sectors need to come together and work together, not against each other. There is no time now for us to pull in different sides in terms of how do we access healthcare services. Health is a fundamental right. Everyone has a right to life, and everyone has a right to quality healthcare services. So that is the responsibility of the government to facilitate that conversation so that we have better healthcare services. That is funded by our own country so that we don't go around and depend on foreign funding and then we find ourselves where we are today.
As we close, Sibongile, this might be a strange question, but could this be a much needed push for us to actually do what you've just suggested?
Yes, I think so. In every bad situation, there's something good that you need to come up. You need to take a positive attitude that you need to take. This is a learning curve. Whether a U.S. government decides to give us back the funding, but we shouldn't relax. We should make sure that with the limited resources that we have, we use them wisely. We stop taking money from the public purse and do things that are not supposed to do. Government officials and government authorities, they should stop stealing from the government and from the public purse and make sure that people of South Africa are receiving the right health and services on the ground.
Sibongile Tshabalala, it's been great talking to you. Thank you very much, Chairperson of TAC. Much appreciated.
Thank you.
All right. Could this be, I hear people complain. And of course, somebody sent me a message earlier on to say, yeah, but Orbs, it's Orbs, B-R-A-H, Orbs, B-R-A-H. Yeah, Orbs. Did South Africa really expect that there would be no consequences for supporting Palestine against Israel? Well, be that as it may be,